Lastly but not leastly, for the end of our session today, is going to be Timothy Thomas, joining us all the way from Jessup, Georgia. Tim, take it away.
Good afternoon, everyone. My name is Tim Thomas, and I have the pleasure of following Charlene on that last presentation, so that's wonderful for me to know. But my presentation topic is on humanizing our patients. I work in the prison system, and we have a term that we use to address our patients, and I believe that term is a negative term. And since the start of this since the start of my work, the National Commission on Correctional Healthcare has also determined that utilizing the word inmate to refer to our patient population is a negative term. So what we're looking at is identity first language versus person first language. So what is the difference between me calling you mentally retarded versus me saying you are a person with a learning disability? Isn't it like comparing a green apple to a red one? They are both the same, they just look a little different. However, one is a noun. If I'm saying you are mentally retarded, then it is encompassing your entire being. It is your identity. These words have changed from being emotionally neutral descriptors to stigma-laden negative terms. These words are listing your disability as your identity first, or solely. However, if I call you a person with a learning disability, I am first admitting that you are a person. You are a human being just like me. I am attaching the pronoun of a learning disability to you as a person. The person first movement began in the 70s and 80s when people with disabilities fought to be identified as a person first and not as a label of their disability. Peg-leg Pete would prefer to be known as Pete first and not necessarily known for his peg leg. The identity first movement places the emphasis on the person's condition, whether it's a disability or it's a skin color or it's a sexual preference. The identity first places it on the person's identity. Person first language places the emphasis on the person. We are all people, and we want to be treated like people. This goes for all the people we encounter through our lives. This kind of goes back to the golden rule of treat others how you would like to be treated. So what was done as part of my project? I was part of an American Nurses Association group that updated the correctional nursing scope and standards of practice. This work allowed me to interact with other correctional nurse leaders and expand my frame of reference in how we addressed our patients. This work led me to further research the power of words and their impact on our patients. After I did all this research, I put in a presentation and presented on the power of words at the 2019 National Commission on Correctional Healthcare Spring Conference. I only expected a few people to attend my live session, but ended up having close to 50 individuals, which for this conference is a good-sized crowd. And I do not know how many individuals went back and watched the playback after the fact. I also wish that I had some of the teachings that we had during this conference when I did that presentation. I had about 2 hours worth of information, and I only recorded about 35 minutes of it because I ran through it so fast. Hopefully, I'm doing a little bit better with that after some of this training that we have received. But because of the good reception that I had during the conference on my topic, I put my research into a white paper and submitted the paper to my agency leadership. The good news is they did not say no to updating our language. The bad news is that they also didn't say yes. As we were going through the COVID pandemic, like the rest of the world, I was told that now was not the right time. I was a little disappointed, but I have continued to subtly push for the change. I've noticed that some of our competitors are utilizing the word patient in their job application announcements, and I've shared that with my agency leadership in the hopes that we can still look at changing that. There are things that are underneath my purview, and I have changed the wording in those. I am responsible for the national nursing protocols in my agency that are utilized, and through those protocols, I have included the word patient. Inmate has been removed completely from those protocols. I was also responsible for developing, it was supposed to be called an inmate companion program, which is basically a program to have other individuals help our patients that are needing mobility type assistance, whether it be escorted or pushed in their wheelchairs up to the chow hall or to the grocery store. So when I did the program, I renamed it to the Patient Care Companion Program, because that should be our focus, is taking care of our patients, not punishing the inmates. And recently I was given the authority to update the technical reference guide for the Inmate Companion Program. And I've already gone through that document and swiped out every word that's inmate and replaced it with patient. I will continue to push for the change in my organization. I truly believe that we have the opportunity to positively impact the lives of the people in which we provide care for, their families, their communities, and since our population is impacted by the social determinants of health statistically more than other populations, we also have the opportunity to positively impact this barrier to healthcare on a global scale. This may seem like a lofty goal, but considering the fact that many of our patients are from across the globe, and we will be releasing the ones we can, they will return to their communities. If all 150,000 of our patients are able to impact 5 people in their community, that is potentially 750,000 individuals that have been impacted. The compounding benefits of the impacts that we can provide to our patients can span the globe and they help us in treating our patients. So what was learned? Well, thanks to COVID, all other large programmatic changes are on hold within my agency. This does not mean that I have to accept the current delay and just forget about the possibility of improving the care for my patients. I can continue to work at my level to impact the change and may not be able to impact all 150,000 patients right now, but I can improve the care for the patients I do encounter. I can make changes in national programs I touch to impact the change across the agency. I can persist until the goal is achieved. Since beginning this journey as a Johnson & Johnson Nurse Innovation Fellow, I have become the chair of the American Correctional Nurse Association Advocacy Committee. The focus is advocating for correctional nurses, but I do not believe I can advocate just for the nurses without also advocating for the patients. I can lead the change and I can impact some levels of change, but I realize that this project is big and will take more than just me. Especially with the multidisciplinary team, we can all approach this change from multiple angles and improve the quality of care for our patients. We can divide and conquer the potential pain points within the realm of our control, and these little changes can ultimately lead to the improvement of care across the system. I would also like to thank Johnson & Johnson, the Center for Creative Leadership, and Nurse Approved for allowing me the opportunity to learn more about myself and go as an innovator through this fellowship. I learned that not all innovations have to be a new product. I believe the goal of innovation in healthcare is to improve the quality of care for our patients. Nurses did not become the most trusted profession for the past 20 years on the Gallup Honesty and Ethics poll by focusing on becoming rich. We have held this title because we continue to focus on our patients. I would also like to thank my fellow co-fellows for joining me on this journey of self-discovery and for developing the friendships that we've had that will last us a lifetime. Turn it back over to you, Rebecca, for any questions.
Tim, thank you so much for that entire presentation. I remember back in the day when we found out that there was an officer joining us potentially, and the amount of effort that went to getting you cleared to be able to join this fellowship, because we thought that the potential that you had to shape an entire system, as is coming out in the comments, that you cannot have identified a bigger challenge in making this change within a bureaucratic system is a huge accomplishment. And what a lesson you have learned that we can share with other nurses about how you just reframe that conversation. So I just want you to know that it's made a huge impact. So the question that comes in, this is so important, Tim, from Bongi Sabanda. How do you intend to share this practice with the global community and advance patient-centered care in prisons?
So one of the things that we're doing is, and especially through my work with the American Correctional Nurses Association, is we're working on publishing. So this is one of the things that as we work on getting this implemented within my organization, we will work on publishing some of the findings. And what we're hoping to find is some reduction in recidivism, some positive patient impact where we're seeing their care numbers improve, as whether it be the diabetes, their hypertension, the national performance measures is what the terminology we use, but we see these metrics improving. So it's going to be, we're going to share this information through the publications and through the just sharing of the data that we are collecting.
And I think that's absolutely an excellent way to get it, because I think, to your point, are the ones that Bongi is calling in all the way from the United Kingdom to hear you speak, but you represent so many nurses across Africa. So that's just an inspiration. Your message is being heard around the world that there needs to be change. So right here, right now, it just already tells me that there's an incredible opportunity here. Shannon Butler asked, for all the innovators, now that you are consequential decision-making tables, because you've sort of been elevated into that role, what ways are you ensuring that you're not the first and only to be recommended to these type of positions of influence to do an increase and accelerate the numbers of nurses there are in these roles? And Tim, how are you doing that? What conversations are you having? Who are you engaging with right now to sort of draw attention to the world of innovation within the entire greater public health system at the United States?
So I think I know where you're going with this, but I'm also going to bring up something else. Is one of the things that I think is very important for us as the fellows is we have to bring people up behind us. We have to, as a term that one of my great mentors uses, we have to reach back and help others up. And so that is one of the things that I've been working on, is reaching back and helping other individuals come forward with me. And there's been some nurses that I've identified through some of my other work that I've been, let me reach out to you. You've got some skills that we can use for something. Let me reach out to you, pull you up, and give you some of that vision that some of the other individuals, or visibility, I guess is the better word, that will get you involved with more of these other things. I'm thinking of one officer that she and I met on one of Sue Hassmiller's meetings with the Campaign for Action, and she was a wonderful officer, and I've brought her, I want to say I brought her. She was already kind of connected as well, but I've pulled her up to some of the things to help with some of the projects that I'm working on with the current Chief Nursing Officer for the Public Health Service, Rear Admiral Mix. And I think that's another area that I'm going to be able to help ensure that I can bring others to the table. Admiral Mix has designated me and another officer to update her Federal Public Health Service nursing strategic plan. And one of the parts of the strategic plan is going to be looking at how we can innovate the healthcare system for the public health service. How can we innovate what we are doing in providing care to our global population that we provide care to?